gives me huge pleasure today to introduce you to James Nobles, who is going to give us a fantastic presentation on systems approaches to improving population health. So I will hand over to you, James.
Thanks, Louisa. It's really lovely to be here and also to see so many people joining. Hopefully everyone is interested in systems approaches. We might all know what they are, or some people might not know what they are. So hopefully throughout the course of the next half an hour or so, I can give a little bit of an introduction to that and sort of give you an update too on like where the research and the evidence base seems to be at with regards to them. So my name is James Nobles. I'm a senior research fellow at Leeds Beckett University, working within the Obesity Institute, but also sat within the School of Health. And for the last sort of, I'd say like 7 or 8 years or so, I've been really interested in looking at how these systems approaches are designed, implemented and evaluated, predominantly within the context of sort of a local government setting. So I'm going to skip through a few little bits here. There is, I think, the opportunity to ask questions via Slido. So if anyone does have any questions, what you can do is if you've got your phone to hand really quickly, is capture that QR code there. And if you enter then the hashtag, which I'm sure hopefully Slido can pop into the chat too, which is LBU Obesity Institute. If you have any questions, you can pop them onto Slido. And then at the end, we will be able to, I guess, take some of those questions and maybe have some nice informal discussion around those. So I'll give you a moment again, if you want to just kind of take a picture of that QR code, then as I say, you can submit any questions there, or if you want another option, I'm sure you can pop them into the chat here too. So what am I going to be talking about? So there are 3 main things that if you take nothing more from this talk today than these 3 key points, I will feel like I've done my job reasonably well. A lot of what I'm talking about is, I guess, a summation of the work that we've been doing over the last sort of 6 to 8 years. And hopefully you can see there is a bit of a nice theme through it, but I'll also be presenting some of our ideas and our thinking as to where we maybe need to look to be going in the future as well. But as I say, if you take nothing more than these 3 points here, then I've done quite a good job. So the first one is a little bit of a recognition as to what the high quality evidence base looks like when it comes to looking at issues around, say, the prevention of overweight and obesity, and potentially also other public health issues too. And I'll get onto that in a moment. The next bit is to look at sort of where the research is at with regards to systems approaches. And as it says here, it's still very much actually in the early days. But the good news is, from a practice point of view, things there seem to be going much, much quicker. So shout out to people who are working in the research and academic fields. We need to kind of roll up our sleeves and get doing a bit more research and evaluation on what's already underway. And then the final bit that I'm going to present is about some of the, I guess, the core building blocks for us to reflect on when implementing a systems approach in a public health context. So to kickstart then, I'm going to actually start off by talking about sort of the quality of the evidence within the context of childhood obesity prevention. But as I said before, a lot of this will also be applicable to many other public health issues too. So this triangle here is a really good starting point when looking at the quality of evidence. And so for a long time and coming out of like the medical sciences, this research hierarchy has very much led the way with what constitutes high quality evidence. So if we look at the top of this pyramid, we've got the synthesized or the filtered evidence, and here we've got systematic reviews, and many of these might include a meta-analysis. So these systematic reviews are bringing together the evidence from lots of similar I guess, interventions or approaches to try and get an overall understanding of whether or not things are useful or not. If we go below the filtered information, then we can see that randomized controlled trials are deemed to be some of the highest quality of evidence. So randomized controlled trials go to like quite extraordinary lengths to ensure that the effect of an intervention can actually be attributed back to the intervention. So we control for lots of external factors as best we can. So if we go down this line of thinking then, the best place to look for high quality evidence on, for example, the prevention of childhood obesity would be a systematic review of evidence that comes from randomized controlled trials. And luckily for us, there are quite a lot of these available. So on the left-hand side of this slide, you'll see a report from the Cochrane collaboration. And this is all about interventions for preventing obesity in children. The Cochrane collaboration published arguably some of the most rigorous systematic reviews that we have available. And we've got quite a number of these Cochrane reviews available around the prevention of childhood obesity. So we've had these published in 2002, 2005, 2011, 2015, and then most recently in 2018. And there's many members of our team who have been involved in the development of these. But what they also help to demonstrate is just how much high quality evidence is available in this field. So in 2002, there were 10 studies included in the Cochrane Review on the prevention of childhood obesity. And if we look in the most recent paper, there were 315 studies which were eligible for inclusion. But I think only 152 of those were actually looked at in more depth. But what this does is it demonstrates just how much evidence and high quality evidence there is available. So from a policy and a practice perspective, if we need to be making evidence-based or evidence-informed decisions, then there's an awful lot of evidence available for us, I guess, to have a look at and to help inform those decisions. But what colleagues and I wanted to do more recently was actually, I guess, apply a bit of a critical lens to the evidence that's included within these kind of systematic reviews. So what we did is we compared the focus of the interventions included in these systematic reviews, and we compared them against the causes of obesity, and we did so through a wider determinants of health lens. So this is this here is the paper that we published. If anyone wants to have a look at it in more depth, you can do. We can share the link to that afterwards. But I'm going to just talk briefly about what some of the main findings were from this paper. So many of you, if you're working in, I guess, research and practice and policy, will probably be very familiar with the wider determinants of health or the rainbow diagram. If anyone's not familiar with it, what it demonstrates is the various different levels of a system that can have an influence upon our health, from individual lifestyle factors. So that's it's orange on my screen, but it might be a different color on your screen. So orange on my screen are the individual lifestyle factors. So the food that we eat and the activity that we do, the work that we might undertake, more, I guess, behavioral factors. When we go out to the yellow band, they are the social and community factors. So I guess it looks more at the people who are around us, so work colleagues, neighbours, friends, family, etc. And then in the green and the purple bands, we've got the living and working conditions and the wider conditions. So the places that we, I guess, work, play, and age within, and the factors that are part of that. So a few years ago, what we did is we categorized over 200 contributing factors which are driving the population levels of obesity. We categorized them against the wider determinants of health. And what we found was about 60% of those causal factors were, I guess, they lay within the living and working conditions and the wider conditions, as opposed to, say, being biological or individual lifestyle factors. Now, this is very crude, but it was quite useful in terms of demonstrating where we see a lot of those causes lying with regards to the wider determinants of health. And then what we did is we looked at the focus of those studies that were included in the Cochrane Review, and we looked at those through this lens. And what we found was actually really quite stark. We found that, sorry, just one second. We found that nearly 60% of the interventions that were included in that Cochrane Review actually focused on trying to change individual lifestyle behaviours. So they often did this through trying to educate individuals on how to make more health-informed decisions. And even when you look at that sort of green, the green band in the living and working conditions, there's about sort of 35% of interventions tried to act at that level. But when we look at those in more depth, given that the focus of this was around childhood obesity prevention, we found that they Two were typically based in schools, and what they were trying to do in those schools was often, again, educate and inform young people and their families on how to make better lifestyle choices. So I guess the evidence base that we have at the moment isn't necessarily accounting for the complex causes of overweight and obesity that are on the left-hand side of this diagram. So it really demonstrates that we do have this skewed evidence base. And so if we need to be making decisions based upon the high quality research, I guess then this may be having quite a skewed impact on where those policies and those interventions might be focusing. So somewhat in response to this, and in response to many past attempts to prevent overweight and obesity, we've seen academics, non-government organisations, government organisations, and international agencies calling for what are regarded as systems approaches. And I'll get onto these in a moment. So we've seen a really big, rapid rise in the emphasis around the use of systems approaches. So about 90% of all of the published studies have actually come out in the last 10 years on this sort of topic. And we've seen these approaches being called for with regards to the prevention of obesity at a population level. We've seen them being called for around trying to increase and improve physical activity environments. And we've also seen them being called for with regards to a much broader range of public health issues. And again, like the Scottish government, they actually place a systems approach right at the heart of their public health reform. So I guess what are we talking about then when we say a systems approach? There's quite a few different definitions for what these mean, but when I guess I'm talking about this in the context in which I'm talking about this in this talk today, on the left-hand side, this is very much what I'm meaning. And I actually really quite like the definition too that's on the right-hand side, which was included in an Academy of Medical Sciences document late last year. So from my perspective, in that which was included in the Public Health England guidance on how to develop a whole systems approach to preventing obesity, we very much defined a systems approach as a way, as a framework which brings stakeholders together to try and develop a bit of a shared understanding of the reality of like the challenge and the issues that we might be working against, to try and understand how like that system and all those different factors are kind of contributing towards this problem. So we're not just seeing it as an issue which is driven by one or two things, but actually it's a real interconnection, a real mesh of things that are driving that problem. And if we can gather that collective understanding of the problem, it then might become possible for us to identify collectively places where we can intervene within that system. And so it's about trying to get collective agreement between lots of different stakeholders who might work across many different organizations and many different sectors to agree on what actions they might undertake and to be accountable for those actions. And so it's about deciding again as a network how they're going to move forward to bring about that change. So it's an approach which will keep evolving and adapting over time in response to, I guess, some of the challenges that we might be facing within a public health context. So with that being, I suppose, a bit of a working definition, or at least the working definition that I'm speaking to, I guess, what does the evidence base look like around these kind of approaches? So unfortunately, at the moment, we're not seeing a lot of good quality research yet in this field. So in our review of the evidence, which was published back in 2019, we found about 65 studies implementing something which resembled a systems approach in a public health context. And 33 of those were focused on obesity prevention. When we looked at these in a little bit more depth, and we categorized them again. So NICE back in 2010 provided some definitions for what some criteria for what a whole systems approach might entail. When we compared those 65 studies against those 10 criteria from NICE, we found that only 13 of those studies actually seemed to meet all of those criteria for a whole systems approach. And when we looked further into those, only 5 of those were actually reporting any outcome or impact data. The rest of them were really process-related evaluations to try and understand what it was that was going on within those studies. But what it did suggest was that the closer to a whole systems approach those studies got, so even in studies which were meeting 8, 9, or 10 of those criteria, it kind of was giving us an indication that more positive outcomes were likely. But when we're talking about positive outcomes here, we're talking about things like changes in health-related behaviours as opposed to changing more of those environmental factors and determinants which might be having an influence upon the health of populations. But one of the other main things that we found within this that was actually there's very little like systems thinking or systems science being used within these studies. So the majority of the interventions that were included were maybe multi-level or multi-stakeholder interventions rather than more of a comprehensive systems approach, which I talked about on the slide before. And I'll also come back to this a little bit later. So just in summary from this paper, it seems that we are really lacking quite good quality research in this field. There are also, just to kind of caveat this, there are a couple of other papers which are available now. These aren't published, I guess they're not necessarily published academic papers, they're published reports which have had academic teams involved in them. But these two papers here, or documents, should I say, have been published in the last year or so, which again draw quite similar conclusions to those which I have alluded to on the slide before. But if you did want to have a look at those two, then again, we can share the links for those afterwards, or I'll be able to share a copy of the slides afterwards too, and you can pick up on that from there. But this, again, is within the context of systems approaches to the prevention of overweight and obesity. But there are a number of other reviews available which look at, I guess, a number of other public health topics. So we've got one by Tracy Now and colleagues from Australia, which looked at the evidence around systems approaches in the context of physical activity. And then one by Gemma Carey and colleagues, which look more broadly at systems approaches within public health. So both of these two studies included over 100 papers within each, but the results actually across both of them were fairly consistent. So what they found were that they're, especially in the paper by Gemma Carey, which is a little bit of an older paper published in 2015, there were a lot of calls to action being included in that paper. So people advocating for systems approaches as opposed to an evaluation of them. But when we look in the paper from Tracy Now, which is a bit more recent, we saw less of those calls to actions being published and more actual like empirical studies. But when we look at sort of the similarities within them, what we see is apart from those calls to action, we see lots of studies which are using sort of systems modeling or simulations techniques. So they might be using something like systems dynamics modeling or agent-based modeling, really there to try and get a better understanding of like what it is that's driving a problem to act in the way in which it does. So it's not necessarily about the implementation of a systems approach, at least how I described it previously. So it's about the methods as opposed to implementation. And that really, I guess, from those two papers was probably the main, I guess, summary that we can draw from those. Other papers too were using like systems thinking or systems science as a little bit of an analytical lens. So they might have undertaken some qualitative work to evaluate potentially more of a traditional public health intervention, but they did that through the lens of a complex adaptive system. So they might have been looking at the I don't know, feedback loops. They might have looked at some of like the non-linearity, etc., around a particular intervention. So really, we are very much lacking good quality evidence around the implementation and the evaluation of these kind of approaches. Now, what you might have noticed from this paper and from some of the others is one of the main challenges that we've got in this field, and I see this also from like speaking with people who are working in local government, is actually around terminology and whether or not we're all talking about the same thing when we're talking about systems approaches. So I've spoken, as I say, to lots of people about these sorts of approaches over the last sort of 6 to 8 years. And I've heard people using a lot of very different terms when they're when talking about systems approaches, but using very, very different terms. So this slide here just gives you a little bit of a flavor for the different types of terms that have been used in the context of a systems approach. And they don't all necessarily mean the same thing. So quite often we might be at odds when talking about systems approaches. For example, systems thinking could be seen as a way of like viewing a problem or a way of working. Oh, sorry, used to help a way of working. Cross-sectoral working might mean working with different partners from different sectors rather than in silos, but you don't necessarily have to use something like systems thinking in order to work cross-sectorally. Similarly, a whole of community approach might point towards engaging community members in an intervention, but it doesn't necessarily require systems thinking or cross-sectoral working. So when we put all of these things together under the umbrella of a systems approach, it becomes really quite difficult to understand what people actually mean when they say they're implementing a systems approach. So cross-sectoral working, for example, might be very, very useful, but systems thinking, on the other hand, might not. That's just an example. It's not to say that that's the case. But if we do start grouping all of these things together, then we risk making false claims about the effectiveness or not of systems approaches. And so trying to be very clear on what we mean when we say we're implementing a systems approach is something really to be quite mindful of. So the conclusions that I guess I've alluded to on some of the previous slides have also been drawn by others. Susan Jebb and colleagues published an expert consensus around systems-based approaches in public health back in 2021. And this is a really, really useful document to go and have a look at if you're interested in learning a little bit more about where things are up to at the moment in this field. So as I say, the 5 main conclusions basically corroborate a lot of what I've already said, that we have a wide range of systems approaches being implemented, but they very much lie along a continuum. So at one end of that continuum, we might have a very traditional public health intervention, which is being evaluated through a bit of a systems lens. In the middle, we might have approaches which are using things like systems dynamics modeling or agent-based modeling to get a better understanding of the dynamics and the causal factors within a system. And then at the other end of that spectrum, we've got potential like the implementation and the evaluation of those more comprehensive systems approaches, which I gave the definition for earlier. As I say, terminology is a real big barrier to the adoption of these approaches and working in this field. But also we're seeing that there's lots of challenges, if you like, in applying sort of systems-based methods in practice. Quite often this is because of the need to bring people together from different sectors and different topics and from different almost like philosophical standpoints, trying to get them actually working together around a collective goal. So that is a real challenge, if you like, in working in this sort of way. And the last point here is around sort of the where we are right now is that there's limited evidence as to the value of systems-based approaches. Now, that's not to say that they're not valuable. It's just to say that we haven't yet got the evidence to help us understand this a little bit more. But it was the future recommendations for me that were probably the most interesting bit of this report. And hopefully a lot of these feel quite, I guess, commonsensical to everyone here. So the first was about developing a global community of practice around systems approaches. Given that so many people and places are now using these and they're talking about using these, it's to try and bring those people together so that we do collectively get a bit more of a shared understanding of what's actually going on within this space and what are some of the difficulties that people are facing, and maybe how as a community can we start overcoming some of those. So it's about trying to speed up and improve and strengthen the work that's going on around systems approaches. It says within this report to maybe do that at a global level, but I think there'll be an awful lot of benefit in doing this at both a global, national and local level, because these kind of systems approaches are being applied at many different levels. The second main point was that funding is required, I guess, to support both the implementation of these approaches, but also from an academic standpoint, and the bit that I was probably more interested in is, well, actually, we need some more funding to really study what's going on within these approaches. And if we get that, then there's the opportunity to really build and strengthen the evidence base around these sorts of approaches in the future. But in order to do that, as I say, we need to have a better understanding for what a systems approach entails. And so for me, this is where I think like there are some real opportunities as we go forward to build that better understanding of like where are we now with regards to the use of systems approaches in public health, be that in the context of overweight and obesity, physical activity, and maybe many other different topics. So I've found at least, I'd say, 9 published examples that probably point towards some like the common principles of a systems approaches. And there's a lot of overlap between all of these common principles, and they can probably be boiled down into sort of 7 core principles or building blocks. And if we can have a look into some more of these building blocks with regards to what's going on locally, then we might get a better sense of like, I guess we get to lift the hood a little bit on what's going on within these systems approaches so that we can really get that understanding of how they're operating in practice and maybe therefore where there are opportunities to strengthen these as we go forward. But as I say, like these, this messy mind map, if you like, can probably be boiled down into 7 different building blocks. And what I'd like to do just for a moment is just to kind of describe what some of these 7 building blocks are, because I think if as a collective of people, we can get, as I say, a better understanding as to how maybe each one of these is being worked towards or not within a systems approach, we can then understand more about, well, where do we need to maybe strengthen these approaches as we go into the future? And also, how can we share learning about what's happened with regards to some of these building blocks in certain areas that may or may not be translatable into other areas. So the first one of these building blocks is that we should be trying to apply like this complex systems lens to all of the working that we're doing. So people start recognizing that they work within a complex adaptive system and that this system will keep evolving over time in response to our efforts at changing it. The second is that the approach should have a focus on like building relationships between people, communities, organizations, and sectors, and also aim to increase, I guess, the collective capacity for people to meaningfully engage in these approaches. And so along that line, we need to make sure that we've got effective communication mechanisms in place to facilitate the flow of information between people and organizations so that they can collectively have a bit more of, like, say, a shared vision, among other things, and so that vision is like held by all. The focus of the approach then should be on sort of collective action as opposed to siloed action. And this might also need people to think, I guess, a little bit more creatively or outside of the box in order to try and identify what some of those key levers might be for changing the environment that people live within. There's also quite an important focus, if you like, around the sustainability of these kind of approaches. And one which accounts for some of like, or sorry, it should account for like the systemic issues, the things that are really driving the problem to be as it is, and also to make sure that we're, I guess, remain concerned with issues to do with like health equity. Now, one of the biggest ones when you look at a lot of the process evaluations is actually around this facilitative leadership and governance. And so leaders need to be in a position to create an environment within their workforce that enables that workforce to engage in these approaches. So this might require changes to some of the inter and intra-organizational governance. And then finally, we need to make sure that there's meaningful evaluation and shared learning in place around these kind of approaches so that we can enable continuous improvement within these approaches to occur. And so for me, we really need to start, I guess, aiming to understand how systems approaches are incorporating and strengthening these building blocks. So if we can build up that collective understanding around these sorts of building blocks, then we can start to get a better understanding for how these systems approaches are being applied in practice. I'm going to finish this talk just by doing a little bit of an update too as to what we're doing within this sort of evaluation space, because it really is quite tricky trying to get a sense of like how are these sorts of approaches being applied in practice. Now, one of the things that we are doing, we have pulled together, is something called the Systems Evaluation Network. And myself, alongside Alex Potts, also from Leeds Beckett University, we established this Systems Evaluation Network a couple of years ago now. And the idea of this network is to try and bring people together who are involved in the evaluation of these complex systems approaches in public health in order to learn from each other about what we're doing, what methods are being applied, the context in which we're undertaking these evaluations, so that we can really like speed up the generation of evidence within this kind of sphere. When we initially pulled the network together, we found that so many people were grappling with a lot of the same challenges. And actually, through having and facilitating these conversations, we can bring new ideas to the fore. We can share some of those challenges that we've been experiencing, and also share some of the ways in which we've overcome those challenges. And so through this network, we provide like upskilling opportunities for members who are part of it, and also through, say, the sharing of resources. So it's very much a network that's there to support academics, practitioners, policymakers who are working in the field of evaluation, in particular around the evaluation of systems approaches in public health. And the idea is too that we can really sort of get some collaboration going too between members of the systems evaluation network. This really has taken hold over the last 2 years. So when we initially started it, I think there were about 50 people joined us in the network. And now 2 years on, we've got sort of over 600 people from all over the world who are part of this, very much like a virtual online network. And the way in which it operates is that every sort of quarter, we have a systems evaluation network like meeting where we bring, we bring as many people together as want to attend. And the focus of those meetings has been on some of the things which are included in this slide here. So we've got things such as the ways in which people have defined and monitored success within the evaluation of a systems approach. We've had some case studies. We've looked at particular methods like systems mapping and how that can be used to define the boundaries of an evaluation. The last session, which was a really useful one too, was about the use of embedded researchers and how that can support the evaluation of these kind of approaches. The next one of these meetings, which again, I'm happy to kind of share any details of and share that with you, is next Friday, which is going to be looking at the use of social network analysis in the evaluation of these kind of approaches to try and understand how they might strengthen some of the relationships between people who are working in different sectors, for example, within local government. And then we've got the next two sessions are also planned, which take us up until the end of this year. So it's a really, really useful network. It's quite informal. And I think because of its informal nature, it enables people to have quite honest conversations amongst a wide range of different stakeholders from different organizations. So I'm going to stop there. Just a few sort of main summary points from me is that system science has really got quite a long history. If you look at some of the work from Brian Castellani, he kind of puts this back to about the 1940s, 1950s. But when we look at this in the context of public health, we're still very much in the early days with all of this. And so it is going to take us some time to figure all this out. But hopefully, research very much has a role to play in trying to improve its use as we go forward. Things like semantics and the terminology that we use really matters. We've got to be able to clearly articulate what it is that we're doing in both research and practice. And I think otherwise we do really risk making some false conclusions about the effectiveness of these kind of approaches. And it might be, if that was to be the case, that actually people become disinterested about these as we go forward. So I think we have to be careful of that. And lastly, again, this is the shout out to the academics in the room, is that I think practice is very much outpacing research. There's a heck of a lot of interest and use of these approaches in local areas and also nationally, but we don't have very much research and evidence as to how they're being implemented and also around their effectiveness. So I'll stop there. If anyone has any questions, you can drop me an email or get in touch on Twitter. I'm going to pass back to Louisa, who I've got a slide for you, Louisa, as well. I think if you know this one's coming, about the MSc and obesity, and then there's one more, and then questions, if that's all right.
Okay, well, firstly, huge thank you, James. That was a really great overview. And before we launch into questions, yes, just to do a quick plug. So we have our new MSc in obesity that will be launched in September this year. So if anyone is interested, do get in touch or follow the QR tag. Really exciting new program, very much co-developed with lived experience, and will provide a very applied and practical insight of which systems will be an intrinsic component of. So if you've enjoyed James's presentation, you'll certainly enjoy the masters if that's something that interests you. Okay, so on to the Q&A. Now I see we've got a couple of
Sorry, Louisa, there's
sorry.
there's this the coalition as well, just if you want to mention that.
Oh, sorry. Yes,
Apologies.
certainly do. Yeah. How can I forget? Because this is an area that is very close to my heart. The other coalition we are currently developing is an obesity and disordered eating coalition. So this is a co-produced piece of work with Obesity UK, very much driven by need arising from the voice of lived experience to really try and bring together and rapidly grow work around supporting the needs of anyone living with obesity who may also be experiencing emotional or subclinical or clinically diagnosed disordered eating. If you're interested in joining the network, you can follow the QR tag or follow us on Twitter, and please do get in touch. We recently delivered a symposium at ECO last week, which was really successful. And so we'd love to sort of build on the energy and enthusiasm from that. So sorry, James, that's all of the plugs.
I'll stop sharing this now.
Brilliant. So now on to the Q&A, and I can see we've had a few interesting questions in the chat and also on Slido. I know several people have been asking if we can share the slides, so we definitely will be sharing a recording of the presentation, and we can also pop links to all of the relevant links and papers that James has discussed in his presentation. So I've noticed there's one or two questions in the chat that are kind of linked, and it's around the use of systems approaches kind of outside the medical domain. And this is something I'm really interested in as well, because I know during COVID-19 there was a lot of interest around the use of systems approaches, and it really helped to develop the concept. So I just wondered what your thoughts were, because I mean, obviously we're looking at within an obesity lens, but obesity is such a complex disease. It touches on all other spheres, including kind of wider environmental issues, farming, agriculture. So I guess just to hear your thoughts in terms of how do we link up these different systems approaches so we have that overarching system and we're not sort of missing a trick essentially by not linking into adjacent systems.
I think that's a brilliant question, one that's like filled with an awful lot of complexity in and of itself. I mean, when we look at what's going on at the moment, I think what we typically see quite a lot of are systems approaches that are being implemented, say, to prevent things like overweight and obesity, to maybe try and improve the population levels of physical activity, might be trying to improve, say, I don't know, mental health, etc. So we're seeing these approaches being used in quite a siloed way, which I think to some extent is quite on the opposite, if you like, of what the ethos of these kind of approaches are actually about. What I would love to see is, I guess, a little bit more work which is trying to explore what's going on within these almost like siloed systems approaches, for example, around, say, let's take obesity prevention, physical activity, to see actually, are we seeing like quite a lot of duplication of effort within these kind of approaches, or are we seeing that they're working on very different things, and actually it would be very complementary to try and bring or stitch some of these approaches together if we can, so that we're very aware of like what's going on across the piece. But I understand that from a local authority and local public health perspective, that's not necessarily the way in which, like, I guess, funding structures are set up at the moment. And so that too can be, I guess, quite counter intuitive to sort of these sort of systems-based approaches. There are examples that I know of where, I think, for example, Louisa, you mentioned about COVID-19. I haven't seen any papers on this, but equally I haven't looked into it. But I think when we look into sort of some of the responses to things like COVID-19, some of the pandemic responses, in a way, a lot of that is very much working in sort of a systems approach, really. You see lots of people coming together from very different sectors, putting their expertise on the table to try and identify collectively where they can intervene within these sorts of problems. And there's probably an awful lot that we can learn from, say, the response to COVID-19 in terms of like ways of working that might be translatable to other issues too. I've seen like things in the chat around climate change. There's a brilliant paper in the Lancet that was published in 2019, which looks at how systems approaches might help us to address sort of they refer to it as like the global syndemic of obesity, malnutrition, and climate change. Again, lots of the things that we might be trying to do to improve population health might also do an awful lot to improve planetary health. So it's about trying to understand like how do these approaches actually benefit more than one agenda, as opposed to the one that necessarily it might be us ourselves are interested in. And to some extent, that's one of the levers, if you like, to try and bring people in from different sectors, is to say, well, this doesn't just benefit things like population health, it can also benefit and support the agendas of other sectors too.
Yeah.
So yeah, I hope that talks to it a little bit, Louisa. But I don't know the extent of all of the system approaches that have been applied to all these different topics. It's hard enough trying to keep up to speed with what's going on in the sort of obesity prevention world.
Absolutely. No, that's a really comprehensive response. Thanks, James. And there's a really useful question in the chat. So for people without experience of systems approaches, what's the most useful way to get started, particularly with regards to applying to different public health contexts?
So a useful place to get started, I do think, is probably having a look at some of that guidance that we pulled together for Public Health England, and it was published back in 2019, because that's a very pragmatic resource to try and introduce people to sort of these kind of approaches. Whilst it's all framed again in the context of obesity prevention, we've seen that sort of guidance being applied to a wide range of different other issues. So I think that's a really useful starting point. It's got an awful lot of, I guess, again, quite pragmatic resources that are part of it to help support people to work in this way, to get a better understanding of like what their system looks like at the moment that they're working within, to try and understand like which stakeholders may or may not be involved in these kind of agendas at the moment. There is a lot of room for improvement too with that sort of guidance. But as far as the starting point goes, I think that may well be it.
Super. And then we've had another question just come in. Has there been any work done to look at how these findings could relate to connected areas of work, such as food systems, with an impact on health?
Just having another read of that one too. In a way, I think that also speaks to probably what we were talking about beforehand. There possibly has, and I'm not sure like exactly with regards to that particular question there. But I mean, I guess I'd open the floor if anyone else knows of any related work that might be connecting some of these different areas together and how that has an impact upon health. Then I'd love to kind of hear of those from people who are part of this too. But yeah, I think the kind of my answer to the sort of previous question also probably alludes to
Yeah.
that sort of question too.
Yeah, absolutely. Then we've got one last question in Slido, and I think this relates to the first half of your presentation, James, where somebody is asking whether you think the findings would have looked different if other study designs had been included in that kind of hierarchy of evidence.
I would like to say yes. But what we were trying to do within that work is do a critical appraisal of that particular type of study design, which is deemed to be some of the like the highest quality of evidence. If we start incorporating the evidence that might come from things such as like natural experimental designs, which are really useful to try and help evaluate real world policy interventions, then my gut feeling is that we would see a much different distribution there. And I guess what the question back would be is, well, to what extent are those different types of evidence like valued equal to that might come from a randomized controlled trial? And I'd love to see that over time, we do start valuing these types of research designs and the evidence that comes from those almost like equally to that comes from RCTs. There's definitely a place for those kind of RCT study designs, but when working within like complex, messy public health issues, they might not necessarily be the best and most appropriate research design.
Yeah, I couldn't agree more. I've just seen another question pop up. One of our delegates has asked that they must have experienced retaliation from communities where systems approaches have been attempted. What are sort of ways that you would suggest to make communities feel comfortable and accept a systems-wide approach?
That is a absolutely brilliant question. I think it's, again, I don't know the answer to this question, because I don't think we do have an understanding of like where we're at right now with regards to the use of these approaches. Again, anecdotally, based on lots of conversations with people who are working in sort of local public health, the community is actually like there's not all that much work done, I don't think, with communities to try and bring them into these sorts of approaches. So I think it's a really big area to try and build on and improve as we go forwards. When you look at some of the work that's done in other countries, really nice example is like that in Australia. They actually start these approaches like with the community at the heart of them. So they apply something called community-based systems dynamics, and that is trying to understand like what does the problem look like from the point of view of the community, and how can we work with communities to support changing the environment around them. So it starts with communities and understanding the issues that matter to them, and then tries to identify ways of, say, bringing local government and other organisations and stakeholders into the mix too. So I guess it's a different starting point, rather than, which quite often is the way in the UK, starting from a local government perspective. In other areas, their starting point might be, say, working with the community. And I'd love to, I mean, I know there are examples of working with communities across the UK. Like I heard about examples up in Scotland a few weeks ago where they're applying this kind of way of thinking at a very, very local level, and starting and working very much in sync with the community. But we just don't have a good handle yet on what's going on with regards to or within the UK.
Fantastic. And I've just seen Isabel has popped a message in to say she is actually a health improvement coach within a local authority, and they are going to attempt doing that community-based systems dynamics approach, which is absolutely awesome, because it's something I am also hugely passionate about, because having been an author of a Cochrane Review update and been very frustrated that despite a tripling of the size of the evidence base, the key kind of downfalls in the kind of quality of the evidence and also the overarching kind of findings were exactly the same, and it just really struck me that we need to be doing something different. But the thing that really resonated for me was the real lack of data from some of those more traditional structured research designs in terms of tackling inequalities. And I'd love to see more of those community-based system dynamics approaches taken, so we can really start to engage the voice of all experience, all the voices of all with a lived experience. So yeah, I think watch this space, and hopefully we'll be doing more.
Isabel, we'll invite you to the next one to do a presentation on this, because that sounds ace. Oh, you've got your camera at the top. Yeah, that sounds wonderful.
Super. Okay, and then we have sorry, just scrolling through the questions that are popping up. I think you've just got some well done and congratulations from our delegates that have joined us. And I think that is everything in the Slido as well. So unless anyone else has any other questions that they'd like to pop in the chat, or do feel free to pop your hand up and ask James in person, you'd be very welcome to. If not, I would just like to say a huge thank you, James. That was a great presentation, really interesting discussion, and I think there's lots more exciting work to follow. So huge thank you to everybody for joining us today, and I look forward to seeing you at the next seminar. So thanks ever so much. Take care.
Thanks all.